emergency medicine is you don't know what you're going to expect when you're going for a duty. So, and you might be just doing a simple workup for a fever, or you might get to see a lot of patients. Like somebody can come in with a cardiac arrest, somebody can come with a run-over injury, they could be in polytrauma with a severe hemorrhagic shock, or you could just be doing CPR on a neonate at 3 a.m. in the morning. So that's the beauty of it. You never know what's going to come through these doors when you get in for a few days, like calm before the storm. So yeah, and it's a well-rounded specialty. You need to have a broad knowledge of a variety of specialties, because the patient can present to you in any one of the stages of his or her disease process. So it's actually quite challenging to work in a busy ER setup like here. So yeah, I'm very happy that I'm in emergency medicine right now.
Hi, I'm Dr. Don. I'm an emergency medicine resident at KIMS Hospital, Trivandrum. About emergency medicine, I've always been enthralled by the amount of work that comes in a day and how it can come down to nothing. I mean, in just a minute's time, you're in and out of a totally different environment. Every minute is a new minute. After my MBBS training, the next step was choosing a specialty. I always wanted to pursue a specialty that would push me to learn more every day. One that would give me a new challenge every day. Emergency medicine just that. It gives you a new challenge every day. It gives you a wide variety of cases, and you need to have a wide variety of skills from you to help save a patient's life. I chose emergency medicine apart from many of the other radiology, neurology and other specialties, because this gave me the unique chance to spend time with the patient when he most needs help, when he's most vulnerable.
Hi, I am Dr. Shastri, working as a senior consultant accident and emergency of the Max Hospital, Saket. I am here from the last 8 years. Check up the carotid. 10 seconds for you. Is it there? No. Come on, continue CPR. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Now in India, almost from the last 5 to 10 years, many of the corporate hospitals are changing the boards from casualty to the accident and emergency system. We have got a very much advanced ambulances have been developed to take care of the pre-hospital care. So pre-hospital care and emergency care has become a very important advanced thing now. Now we have got everything in the emergency department. We do bed tests, bedside tests, POCs, point of contact tests, minimum investigations like including bedside ultrasonographies, bedside echocardiographies, bedside x-rays, and almost we reach a final diagnosis with the availability of the best laboratories which give us the results back. We are able to come to a working diagnosis which is very much near to the final diagnosis, and then at the time of that juncture When we feel that we have to admit the patient, we call the concerned consultants, give them all the feedback, who take them and put them in the hospitals. Otherwise, majority of the patients with minor trauma and minor problems have been discharged from the emergency. Ready? 1, 2, 3. Okay. How is the report? BP is normal, everyone, but there is an injury to the right upper hand. Okay. One is not counting. So elbow is there. Any injury to the head?
Hi, my name is Dr. Prasad. I'm a third year resident from Max Hospital and doing my emergency medicine specialty. I wanted to do multiple specialization, but after my MBS, I had to choose one particular career as my specialization, and I worked for a few years in different specialties. But the only specialty which gave me immense satisfaction and a challenge every day to work is emergency.
It is really challenging. I mean, it's not an easy job. It is highly stressful. The work hours, see, you always have to be on your toes. Okay. Again, as I said, you have no idea what is coming through the doors, so you need to be on your toes each and every time. You don't have the luxury of time while managing the patient. A critically ill patient has to be managed as soon as the patient starts coming into the ER. You have to start managing. So you don't have the luxury of time. You can't actually, keep on go back and read and come back and then sell to the patient. You can't do that. And then again, management in the department, you are actually dealing with almost every other specialty, because once you resuscitate and stabilize the patient, you have to actually hand over the patient to some other specialty. See, you see patients from all specialties, I mean all walks of life. You start with the newborns, you see babies, you see children, you see adolescents, elderly people, pregnant ladies. Almost every specialty of patients you have to manage, because the unpredictability of the patients, those patients, you have no idea what is coming through the doors, and that is what is most interesting.
It's completely different from all other departments. You'll be coming across all the cases, not just only one single specialty. You'll be coming across all.
You deal with that golden hour where you save lives, and there's nothing more satisfying at the end of the day when you think back and see that you've saved one life today. It's beautiful.
This is the subject which is needed by the public at this hour. They need everything under one cover to attend at their part of the life where they are in a much agony. A patient.
Of any hospital having an emergency is a life-saving area. You should actually consider your patients as serious, until proven otherwise. Okay, you should be dedicated and hardworking. We have shift times, okay, but there is no shift times for us. Maybe when we walk out is a time when a dying patient comes, and we are here for 2 or 3 hours. We have to negotiate with a lot of things, so it's hectic. You should not come into the field thinking that it's just like another day.
I think it's very interesting to come up in such a field, so that you can be different and you can serve the community as well. Not even community, you can save a lot of lives, and lots of advancements are coming up, and we can be special with this.
When emergency medicine came in, it became standardized. Okay, what happened is we have the algorithms of BLS, ACLS, we teach, we train, we are perfected. So we have that stopgap. You come home with your father, your mother, or any of your relatives, they're dying, they're sick, we stabilize. If airway has to be addressed, we address. Okay, we do the life-saving interventions, and also sometimes they might come to us in such a way that we don't need to intubate or ventilate. They might be a few hours before they pass away. We do the interventions to make sure that life sustains.
Hi, my name is Liz Clark, and I am a hospital administrator at Kim's Hospital in Trivandrum. And I have been involved in helping develop emergency medicine standards and programming at my hospital as well as within India. And I'm very excited about the prospects of Indian emergency medicine. It's an up-and-coming field that provides a lot of great potential career opportunities for people who are passionate about emergency medicine. Currently, there are less than 500 emergency medicine doctors in India, and that's for a population of 1.2 billion people. So in terms of finding a job, finding a good hospital that will support your career, the field is wide open. This is really a field.
My name is Tamarish Kule. I am the head and senior consultant of Department of Emergency Medicine at Max Healthcare, New Delhi. Also the current president of the Society for Emergency Medicine in India. I am very excited to share with all of you that emergency medicine has come a long way in India for the last 15 years. And this year, National Board of Examinations is launching emergency medicine as their new specialty course at the primary specialty level. 14 years back when I took up emergency medicine, I was not very sure about the future of emergency medicine in India. But today I can proudly tell you that there are many more departments apart from my own that boost emergency medicine. And this has primarily come because of the public interest of getting good emergency care during the time that you need. Imagine
that Indian emergency departments have some unique challenges not seen throughout the rest of the world. And so people who are interested in addressing those challenges are very welcome in an Indian emergency medicine department, whether it's at my hospital or at another good hospital. And there's certainly some excellent hospitals in India that will require your services. You will be very attractive to a potential employer. So I'm going to urge you, if emergency medicine is right for you, not only should you take the Dnb program in emergency medicine, compete for a seat, but as equally important, stay in India and build something great in India. I encourage you to do this not just for yourself, but do this for your community. This will be one of the most rewarding career choices.
Talking of the career options in emergency medicine, after 3 years of successful completion of emergency medicine, you can choose subspecialties which people do in emergency medicine, and they are critical care. You can do a fellowship in emergency medical services, in disaster medicine, in ultrasound, and many more which are yet to come in our country. In summary, emergency medicine is a very unique specialty. We are there for everybody, for everything, and at every time. So if you remember these 3 E, I'm sure you will be liking the specialty and make a great difference to every Indian who may need emergency care at the time when the resources and the people are not there, and you can make a big difference in their life.
My aim is emergency medicine, to be an emergency medicine physician.
Take a look at emergency medicine, the whole new face of medicine.
Emergency medicine, working on my dream. We are proud to be emergency physicians.